Everyone, welcome back to my channel. I hope you have been liking all the CMPA readings and videos for different topics on good practices. I will be uploading them as I get some time. Today, I'm going to talk about how to use CMPA website to get the resources related to your ethics. Number one, why you need to get those resources from CMPA. What are the things you can do to make your ethics portion very strong before you go for QE1? As everybody knows that when we are working for QE1, it's very important that ethical portion should come on our top priority list along with the other few important aspects of the medicines like gynae, like obstetrics, like peds, like psychiatry, like family medicine. So ethics is also considered as a topmost priority, and you will always get the cases of ethics. There is no way that you don't get a case of ethics in QE1 exam. So without wasting any time, let's get started. First of all, I'm just writing on Google MCC, which is, as we all know, it's our website. If we go on MCC website, there are multiple things. Number one, our main target is to look on the objectives. I have uploaded a detailed video how to use these objectives and what are the resources which you need to use for your QE1, so you can go back and follow that part. At this point of time, why medical expert is an important topic for us. Medical aspect is basically one of the CanMed's roles in which they are talking about the knowledge and the theory based topics of exam. So as we come here to the medical expert, you will find there are a bunch of different topics, and if you go on each and every topic, clicking on them, you will find what are they looking for. So similarly, in the ethics portion, they are looking for these things, which is concern, truth telling, negligence, legal system. But they are not just looking for this. They have given you the topics. That's good because it helps you to see where you are in terms of remembering things and understanding the process. But they have given you multiple different things which you have to also navigate. Let me take you through the MCC website again, and then we can jump to CMPA website. Oops, my bad. So this one, when you go here, you will see there is a few different bars which you can see here. If you go back on this one, I pressed this one before. Now I'm pressing on the resources to help the exam preparation. I know most of us don't go on this website, don't look after the things for theory purposes, especially for the medicine portion. But if you are on for ethics portion or the public health portion, it is very important that you go and talk about it. So there are multiple things. Objectives, I have already told you. I'm going to talk about the resources one. I'm going on the resources one. You will find a couple of lists. I'm just going to search it for my MCCQE one, and I'm interested in few of the things which is important for my perspectives related to QE1 exam on the ethics portion, right? So I'm just going to put few of the options. Let's suppose I put all 3-4 options. It might be possible there might be some of them like virtual care and practice could also come somewhere into the ethics, because you have to look for what you are doing in the virtual care. I'll just give you a brief example. When you are booking a patient virtually on phone call, you call them and they did not pick up, but their voicemail shows that you can drop a message. On that dropping a message, you cannot drop any diagnosis, any test results, anything. You just have to say, hello Mr. XYZ, I'm calling to XYZ doctor, I'm calling regarding your virtual appointment, please give me a call back at this number. You don't have to tell the reason of the call, you don't have to tell the diagnosis, you don't have to tell anything on the voicemail, because you don't know where the phone lies at this moment and if the patient is having the direct contact number or it's someone else. So that's a virtual one. That's just a brief example to give you an idea why the virtual care is also comes into the ethics portion. So when you go here, you'll see the CMPA international medical graduate resources. As for international medical graduate, definitely this is one of the things which we have to do, but there are multiple other things which we need to do. So if I'm navigating here, concerned, truth telling, negligence, legal system, I'm going to tell you few of the most important things which you can learn and read from CMPA websites. This one is definitely an important topic. These are all the learning topics: informed consent, documentations, speak safe to speak, and effective communications, privacy and confidentiality. But there are other also, which are basically good practices. If someone say, okay, if I read all of these, will I be able to clear my exam? For sure, because ethics is not the 100%. But do you want to get the maximum score in ethics? If yes, then you might have to dig a little bit more. So this is one of the things. But I will tell you what, if you want to use this, you can use it. Otherwise, the other way is the proper way, where you will find all the things. Do you see here two things, good practice and e-learning? These are very important topics. Let me jump to the e-learning first, and in that e-learning you will find out that these are all the topics are already there. So when you come here, there are multiple topics available here: professionalism, communication, privacy, confidentiality. You can read documentation, you can read informed consent, you can read informed discharge, you can read medical letters, you can read about delegations and supervision. This is also an important topic. You have to read about situational awareness, interprofessional. As much as you can. It takes only 15 minutes of your time. If you do it every day, it won't take you more than a month. Just one topic every day. You don't have to read all of these like obstetrics, but it's just the 15-20 minutes. Speaking up is also a good important topic. So whatever the topics are given here, and the list which I showed you in the other link is being taken from that part. So you can use this link to maximize the knowledge you need. Maybe something you don't need, but you have read it, but there's no harm in that. So that could be one of the things. So this is about e-learning, which is very important. Second one is the good practice. Good practice, if you go here, or you want to go and the educational part and you want to do here, that's still the same thing. So here, when I go back to this stream, this one, you see additional explorer, additional resources, explore additional resources, my bad, sorry, cultural safety, good practices stuff, physician collaborative care, healthcare, and medical legal cases. If I'm coming back to this one, you will definitely find most of them. And at this point of time, I am reading all of these topics and making videos, so you can check it out. If you don't want to read the whole big topics by yourself, you just want to listen, and if you are a good listener, it will be helpful for you to just review my videos, and you will find a lot of beneficial information. And maybe I try my best to put some of the examples so that it will help you to understand why we are reading this, because nobody is going to ask what is written in CMPA. They will give you a scenario, and you have to apply this knowledge into that scenario. That's the biggest challenge. Nobody's going to ask you to remember. It's just for your understanding. So I have talked about e-learning, I have talked about good practice. Internal national medical graduate resources are basically combination of these two. The one more important things which I feel like it's very important for us is handbooks. When you go on handbooks, you will find these ones. If you go on the topmost, and there's a concern guide. Why I'm saying that you need to read this concern guide? The reason is, when you go back to the objectives, you will find the one of the objective is the concern, and concern is very, very important. So if I take back you here, concern, truth telling, negligence, legal system you might find in the e-learning. Concern you can find in the handbooks, which I just came here. This is definitely a big topic, but it's worth to read once and understand what the things of assault, battery, what type of concern, where to take concern, where to not to take concern, where is implied concern, what is the age of the concern. So these are all the things here. Last but definitely not the least, I know it's a lot, that's why I always feel myself that my reading for ethics every day in my whole 6 to 8 month of preparation helped me to complete all of these things. You cannot complete it in a week or two, that's for sure. If you are a very good and fast speed learner, that yes, you can. But if you want not to be overwhelmed with the situation, just read 1 or 2 topics every day before you go to bed. That will be helpful. And the most important thing is medical legal handbook. Of why I'm saying medical legal handbook, the reason of telling you the medical legal handbook is legal system. You can find a legal system in e-learning. There was a e-learning topic before, but at this point of time, the medical legal is given at this point here, and they have given some concern. So again you will read some concern here, again you will read some confidential. It's a back and forth study, so it's basically a revision of most of the things. And in firearm acts and medical certificates, these are not highly given in terms of objectives, but it is good to learn. I'm just saying extra learning is good rather than making yourself limited to few topics and few topics you're not aware about it. So this is all about it. For e-learning, there are many things. In my opinion, it is worth to read it. I'm not saying that you should be reading everything from the day one, but as much as you can do, it's important for you to do it for your QE1 exam. So this is all about MCC. Takeaway points from the video is, number one, you read the e-learning topics as much as possible. You read the good practice. If you're reading good practice and e-learning both complete, you don't have to go to these resources. But if you're not having a time enough to read both of these topics, at least read the topics which are here. Apart from this, when you go here, you will have a handbook here. If you go on handbook, you will find a couple of things here, and in the couple of things you can find about medical legal, about concerned, about other stuff. Electronic record handbook. I'm not sure now that the objectives are also asking you for the electronic record, but it was asked in the past. Let me just, so no, there is nothing like that. So probably they have just removed it. It was in the past where they were asking about virtual care stuff 2-3 years ago. I remember that part. So that's fine, but at this point of time, these are all the things which will help you to navigate it. One more tip which I would say is, if you are a very keen person to get the correct answer of any question and you don't know the questions and you are not able to figure out the answer from any resources, use this search box. Why I'm saying this, use this search box, is when you use this search box, let's suppose police, you will find few topics related to police. Maybe your question is asking something about police or something. When physician being bullied, what to do? This is very important for cultural safety. So this search bar can help you. You have to write the few keywords and see if one of the links are opening up into this point is related to you. If yes, then go and figure out your answer. I use this search box a lot, and this helped me to get the answer before I go to bed, because I cannot sleep with an unanswered question when it comes in front of me. So this is all about CMPA website. At this point of time, I'm reading good practice, but as the time goes, I will be uploading few more topics from the International Medical Graduate Resources topic first, because few of them who don't have much time, at least they can go through in this one. So this is all about today. If you have any question, any confusion, or any kind of suggestion or advice, please feel free to leave your comment, subscribe to my channel, and let me know what's the interesting topic you want me to study. And when is your exam? Good luck for your exam. Thank you so much.